Okay, this is someone who is on a Medigap Plan F and wants to take a look at the Medicare Advantage PPO from Blue Cross. They're a little bit apprehensive about switching plans, but we're going to take a listen to see what they say about the comparison of the Medicare Plan F and the Medicare Advantage Plan PPO. Yeah, hi.
Do you have time to talk?
Yeah, sure, absolutely. How can I help you?
Oh, okay. Mike told me to get, can you hear me okay?
Oh, yeah. I have you on speaker. I hope you don't mind.
Okay. Mike told me, asked me to give you a call. He said you had called. I am looking at the personal choice 65 PPO.
Yes.
I read everything. I read over everything. I don't know if I'm making this more complicated than I need to. I feel like I need to compare what they're offering with KSKJ. And I have to get a summary, I guess, sheet off of them or go online.
Well,
I don't know. Is that necessary for me to do that?
No, because it's two different things. I mean, we can talk about it, and if you want to write down some things, I can, tell you how, the differences and that sort of thing. Yeah, I think it's pretty easy to compare the, the KSKJ plan, the Plan F or the Plan G, whatever it is, compare it to the Keystone 65 Prime PPO, because it's really like apples and oranges. So
okay,
yeah, so it's easy to compare.
Is it the personal choice 65 Prime PPO?
That's right. That's the one I think.
Oh,
yes.
Okay.
Yep. That's what he was looking at.
Okay. The paper you sent, and the reason I'm asking you is the information you sent me that I don't know, the individual enrollment
Okay.
form that has on it personal choice 65 PPO. But I noticed in the book there's different plans,
That's
and
right.
I was reading specifically that particular one. I didn't know it was the Prime. So I
Yeah.
have to read it as the Prime
Well,
information. Yes, we pay for everything. I'm ready to move out of the zip code.
yeah. No, I hear you. All right, let me just pull up. I actually didn't even need your zip, but let me pull up the details of the plan. Okay, so how much is he paying? I know he's paying over $400 for his other plan, correct?
Right now he's paying $450, and in February that will go up. I don't know how much, but it'll go up again in February. They up it every year in November and again in February.
Okay, let me just.
So right now it's $450.
$450. I'm going to pull him up on my thing, on my chart. He's paying $450, and it's going up in February or January.
Normally it does, so I'm assuming it will.
And does he have Plan F or Plan G? Do you know?
He has F.
F.
Yeah,
okay.
because you told me I asked you that once, and you said we couldn't get him out of that to go to a G. We got to keep him in F. Like KSKJ wouldn't change it.
Okay. Yeah. All right. So just doing some math, he's paying $451, and let me pull up a calculator here because my math isn't that great. But all right, so $451 is what he's paying for his GAP plan with KSKJ, and then what is he paying for his prescription plan?
And our prescription plan is only $17 a month, around $17.50. It's
Okay.
$17.50 per month, and but we have a $450 deductible.
Yeah.
Which he uses every year. He uses that up every year, and then we're in the donut hole by September 1st. Like the end of August, kind of does us in.
Okay. What is some of his? I mean, look up. What is the reason why he's? What are some of his conditions?
His conditions are, well, basically he has AFib.
Okay.
Yeah. And now he just had the Watchman put in. Are you familiar with that?
The Watchman?
Yeah.
No, I'm not. What is that?
Okay. He had, well, I'll try to tell you quickly. He had diverticulosis this year, which they consider it a bleed. And because of that, they felt if this happened again, they would not be able to put him back on his blood thinners. So they put the Watchman in, which is like a screen in the heart that keeps blood clots from escaping.
Okay.
Because that's why that's why people with AFib stay on a blood thinner, so they don't shoot blood clots all over the place.
Okay.
When you have AFib, after 12 hours of being in AFib, you could develop blood clots, and they can go wherever. So this is a screen that goes in that particular part of the heart where the blood clots would form. And so it was something the doctor felt was necessary to do. So
okay.
Now he stays on the blood thinner for 45 days and then goes off of it. Once they're sure it has implanted properly, they take you off the blood thinners.
Okay.
So basically that. And, he has a bunch of other things, but that would be the most major. That's what, seems to be the issue. I think you told me that he couldn't change to another insurance because of that.
Because of the
people.
Yeah.
Because of the AFib.
The AFib, yeah. He wouldn't be able to go to.
He doesn't have renal failure or, other.
Yeah,
major.
The thing about AFib is I have other clients that have AFib, and they're fine. I mean, it's not like, if you had a heart attack or something, you're in and out of the hospital and you have to get, stents put in or, whatever. Some of my clients have had AFib for years and they've never done anything with it. They just monitor it. But
that's what the doctor does. He monitors him. Now, he did have one stent put in, and the doctor said, I don't expect to see you back here again. So
yeah.
I don't know what that meant, but anyway.
One of the questions that the GAP plans ask is, do you have AFib? And as soon as you have to answer yes, it's an automatic denial, unfortunately. But, so, basically doing the math, you're paying about $5,500 a year for the Medigap Plan F, and then you don't have any copays or deductibles with your medical with that. Then you're paying an extra $200 for the drug plan, which brings you up to about $5,700 a year. And then I don't know if you have dental, vision, and hearing, but that's a whole separate thing.
Yeah, we don't have any of that, so we pay all that out of pocket.
Okay. So the Personal Choice 65 Prime PPO, that comes with, the medical, of course. You have your hospital doctor covered. It comes with a prescription plan. So you have copays with the prescription plan, but it's zero. It doesn't cost you. So for the plan, it's zero. So you're saving $5,500 a year with the plan for the premium. For the drug plan, it's zero. And then vision, dental, and hearing are zero. So the whole plan is zero, but you do have copays and deductibles with it. So it's not like, you're going to go the year without paying anything. The big thing is, so the maximum out of pocket in network, and I've done a lot of in network, I can look up the doctors and the hospitals and so forth.
Well, a hospital is covered. The book did say Bryn Mawr is covered, but I don't know if
that's right.
Individual doctors.
Yeah, okay, so Mainline Health, yes, is covered. The max out of pocket is $7,550. So basically, with this plan, the max out of pocket is $2,000 more than what you're paying already, meaning excuse me, not two, yeah, a little bit under $2,000 of what you're paying. But now the percentage of people that actually go up to that max out of pocket is really small because you have to go in and out of the hospital all year round, all year long to meet that.
Right.
So
Right.
so that's what you're looking at. And then, I'm sure you saw if in network, your doctor's $5 for the primary and then the specialist is 40.
Yeah, we went through all that. Yeah.
Okay.
We read all that. I didn't read for Prime. I just read the regular PPO, so I don't know how much different it is, but I'll check that out.
Yeah, I mean, well, it's different. It's definitely different.
Okay.
What other questions did you have as far as what major things were the questions? I'm sure the hospital stay and surgery and so forth.
Well, yeah, what about that? Like if you're in the hospital, then the surgeons would be extra. How about tests in the hospital? You had tests done.
Okay, so I'll read off the testing. And are you computer savvy?
Yeah, I mean, I usually manage to get through whatever.
Because I'll send you a link with this. I think I already sent it to you. But I'll send you a link with this where you can look at it and it'll show you everything. But you have the paper. You do have it on paper also. So testing. Let's see here. Okay. So diagnostic tests and procedures in network is a zero copay.
Okay.
Lab services in network, zero copay. Diagnostic radiology services like an MRI in network is $0 to $275 copay.
Okay.
Outpatient X-rays in network, $45 copay.
45 copay, and what is that for tests?
For outpatient X-rays, yeah, I mean that's just
okay. Outpatient X-rays, okay. Okay, and 45.
Emergency room is $90 copay per visit, and that's that's it. And then urgent care is $10 to $40. I guess it depends on what you do there. Copay.
Right.
So that's the testing, the labs, and the imaging. Outpatient hospital. Outpatient hospital can be a $375 copay. It's up to $375 depending on what you do. Skilled nursing is a zero copay for days 1 through 20, and the hospital, if you're in the hospital staying overnight or whatever, it's $250 a day, 1 through 7, and then 0 after that, 8 through 9.
Yes.
Preventative services are zero copay. You have your therapy.
Okay, preventative services, that would be like colonoscopies and mammograms and such.
Yeah, I mean, don't quote me on that. I can get you a list. I mean, the lists are in those booklets. I just have a snapshot here, but the booklets, and I can get you more information on that. But yeah, it would be. Don't know about colonoscopy. I would assume so. That's preventative.
Okay. Yeah, it is preventative.
I thought I saw something colonoscopy in here before, but
I didn't come across them, but I will look more closely. I thought I read every single page, but I'll look again.
Yeah, and then of course the prescription drugs, depending on his drugs, I can look it up for you and tell you.
Yeah, we would have to check that out. Although the Eliquis was the most expensive because that was a tier 3. Everything else he's in is a tier 1 or 2.
Okay. Yeah, so a tier, let me see here. So if you go to a preferred, do you get it mail order or do you go to...
We do mail order.
Okay, let me see the mail order.
Unless it's like an antibiotic that we need right away, then we go over to CVS.
So the preferred retail cost sharing, so whatever the preferred pharmacy would be. And I think it's like Walgreens or CVS or one of those. Preferred generics, 3 month supply $2. Generics 3 month supply $20. Um, that's tier 1 and 2. Tier 3 would be a preferred brand, so it would be $47 per month for 1 month supply
Okay.
and $141 for 3 month supply.
Okay. And he shouldn't need that in about 6 weeks or so. Yeah.
Yeah.
So that'll probably be the beginning of the year.
Now I did explain to you before that he has a one-time look.
He has a one-time what?
One-time look where you can look at the Medicare Advantage plan. You can be on the he can go to a Medicare Advantage plan, and then he can go back to his old plan within a year if he dislikes that Advantage plan.
Oh, okay. Yeah, you did mention that, and that sounded very unusual to me. Now, would it be at the same rate that he left with?
Yeah. I have to, don't quote me on that, but yes, I'm pretty sure it's the same exact rate that he left. I don't think anyone's ever asked me that question, to be honest with you, but yeah, you know what? That's a good question. I'm gonna find that out for you.
Okay.
But what I do know is that there's that one-time look that you can go back to your old plan, and you know what? That's on the Medicare and You guidebook, and I know it's on either page 73 or 74.
Okay.
So I'm gonna look that up.
Okay, and I have that book here too. So
Do you really?
Check that.
Yeah,
I have that. They send it to us every year.
Okay, yeah, I know it's on because I always send it to I send it to people, and I can remember it's page like 73 or 74. I can't remember which one. But
okay, I'll move that down so I can check that too.
Yeah. And it's not called one-time look; it's called something else. But it's on those pages. I'll email it to you when I find it. I can look on my email because I've sent it to other people. So.
Okay.
But.
So now, how will I check out to see if his doctors are on that plan?
So you can go to ibxmedicare.com.
Okay.
I can look at them for you if you want. I mean, that's why I'm here. I mean, I. Okay. It's up to you. How many doctors do you want to look up?
Well, the most important would be his cardiologist.
All right, let me just check real quick. I can check for you real fast. Is it H-A-R-P-E-R?
H-A-R-P-E-R.
And is he in Philadelphia or?
He's in Bryn Mawr.
Okay.
He's with Mainline Health, and his office is one's in Newtown Square, but basically Bryn Mawr, right? That office, yeah, the Bryn Mawr office we usually go to.
Yeah, I'm almost positive he's going to be in here because I've been on the phone for the past couple of weeks talking to people about Mainline Health. So let me just see. Glenn Harper. Am I spelling it correctly? How do you spell his first name with just one N? Glenn?
No, 2 N's. Glenn. Glenn R. Harper.
In Bryn Mawr, you said, correct?
Yeah.
There's a Stephen Harper, Gavin Harper. And he's a cardiologist?
Yes. He's an electrophysicist.
Electrophysicist? Let me look him up on Google real quick. Glenn Harper. Glenn Harper, MD or DO?
MD.
Okay, there he is. There is on Mainline Health.
The name of the practice is Cardiology Consultants.
Okay, I'll look that up too.
It's a division of Bryn Mawr Medical Specialist.
Cardiologist consultant?
Cardiology Consultants.
Cardiology consultants. Because I know Bryn Mawr's in here, but what I would do is I would I'll call the plan and make sure. I'll call cardiology consultants.
I can give you the number if you want.
Let me see if it's cardiology. And also, is it Cardiology Consultants of Philadelphia?
No, this is what the card says. First it says Bryn Mawr Medical Specialist, and then it says Cardiology Consultants, which is a division of Bryn Mawr Medical Specialist.
Okay. Yeah, if you can give me, what is their number?
Their number is...
I'll call them and ask.
Right. And then how about David Fox?
And where is he located? Bryn Mawr?
He's in Bryn Mawr too. Yeah, they're all Mainline Health doctors.
Yeah.
No, he's Newtown Square. I'm sorry.
Okay. Yeah, David Fox, Mainline Health Primary Care, and he accepts all 6 plans. So yeah, he's in.
Oh, okay.
Yep.
How about here's a name for you, Mangalmurti, Mengalmurti.
Yeah, Nilam or Sarang?
Yes.
Which one?
Sarang.
Yeah, okay, he's in here. Let's see. Yeah, he's Bryn Mawr Medical Specialist Associates. Yeah, he accepts all 6 plans accepted from Blue Cross, including the one. Oh, he's the cardiologist.
Yeah, and that's the same group that Dr. Hooper's with.
Okay.
He's the same group.
Well,
and
I can tell you, I had the same thing this morning. There was a doctor that wasn't listed on here, and I called Blue Cross, and then they said, well, you better call the association. And then I called the association, and they said, everyone in this group accepts all of those plans. And I said, okay, because my client wants to go to this specific doctor. And they said, no, that's fine. Every doctor in this group accepts the Blue Cross plan. Yeah.
Yeah, that sounds like it's sensible to me. I mean, that sounds, I can't imagine how they'd be billing if they didn't. But anyway, how about one more doctor I want to ask you about, Dr. David Ellis, Emlis. He is a, what is he?
Did you say Ellis as an Ellis?
Yes, David.
Okay. Yeah, advanced urology.
Yes.
Yep, all 6 plans.
Well, that's great. Okay, because they are his major people that he sees like yearly or semi-annually. So that would be good.
Yeah, and here's the so all of those are in there. So
now, when you go in for surgery, then how about the surgeons? How are they covered? Or is that under the hospital plan, like Part A of Medicare?
Yeah, yes, they are. But that would be if he goes in the hospital.
Yeah.
Yeah.
And I know about the surgery center or the outpatient hospital. We saw that copay. Yeah.
But the Medicare Part A and Part B, when he's under the Blue Cross plan, that's not really how they do it. You're kind of on you're on a PPO, so it's different.
Oh, and how different is it?
Well, it takes over for your Medicare, so it's basically just it's like I said, um, the cost in that booklet would be the cost. The booklet that,
Okay.
or yeah, so it's
Yeah.
not like it's under Part A per se. It's just the cost of, the services. Yeah.
Yes, and we look at them carefully here.
Yeah.
So,
It's it's tough with a lot of people. I'm on the phone a lot with people. Believe me, I have people paying over $500 a month, and I'm telling them, listen, you're paying close to the 75.50 out of pocket. This is even if you had, the worst. So when I say 75.50, and I know this wouldn't make you feel any better because you're not paying, you're paying about 5,700 premiums per year, which is close, but it's not. It's still 1,700 less, or something like that. But I'm telling these people, no matter what you do, you're not going to pay past that 75.50. And my point is people are still apprehensive. They're still apprehensible about switching sometimes.
It's scary because we know the good care he's gotten anytime he's had to go into the hospital.
Yes.
And you're afraid that you're going to be giving some of that up, and it's hard to do that. But let me ask you this question.
Sure.
This plan for both medical and prescription says it's a 3.5-star plan. Now, I'm assuming that KSKJ, for the cost of it, is a 5-star plan.
Well, they actually, do they rate those plans? They don't really rate those. I mean, I could look it up, but those plans are all the same. The F plan is the F plan. So even if the companies, they are rated, I think, but to me is garbage. It doesn't really matter. Really what it is the customer service they give you. Besides that, the plan is the same as everybody else.
Now, when you say customer service, what are you referring to?
Basically, if I don't know, if you ever have a question, you have to call the company.
Okay, gotcha.
Stuff like that.
Okay.
Yeah, it has nothing to do with the care that you're going to get. He's going to get the same care from KSKJ Plan F that he would from Aetna Plan F or Blue Cross Plan F or any company that has a Plan F. Yeah, he'll get the same care.
Yeah, well, he got amazing care over at Bryn Mawr. And I'll tell you, I was in this year too, and I was amazed at the type of care I got. They couldn't do enough for you. So
yeah.
Anyway, it all sounds good from what you're telling me, Brian. Now, let me ask you this. You had called us back, and Mike said I would call you to get more information. Was there another plan you were considering?
No, only the Aetna plan I've been showing people, but I don't like that plan as much as this one. Yeah, especially with your doctors that you have and everything. It seems like this would be a better fit. And this is taken, I just was talking to somebody. I talk to about 4 or 5 people for this type of thing specifically each day. And then, of course, I do so many drug plans per day, it would make your head spin. But but I talked to someone today that literally was like, I go to Florida, I go to New Hampshire, and I go to Maine. And so can you look up this hospital? And all of it was covered with this Blue Cross plan. All the people that he gave me. I just like that, it's peace of mind. It's, now it's a PPO, so you can go wherever you want, but these were in network that accepted the plan. So
yes, you would pay less than you would if you went out of network.
Yeah, and I would think for you, either this year or next year, you're going to want to, meaning I'm not giving you advice, but you're probably going to want to you're going to say to yourself, you know what? Let's give it that one time look because
Mhm.
by next year he's going to be paying almost the same as the total max out of pocket.
Mhm.
So so he, and this is a PPO. You can go to any doctor or hospital that you want to. You would just pay more if they're out of network. Well, if you're already paying that in premium anyway, it would be like,
Mhm.
well, who cares, pretty much. But
Right.
do you know
Yeah,
what I mean?
I do.
Yeah.
Well, mine's up to just almost 200, and I don't know if they're going to change it this year again. So,
Yeah.
but if it's going to be worth it, well, yeah, I guess it would be really when you
Yeah,
think
and
of it.
you don't have to do the same as your husband. I mean, if you want to, that's great, but he could always try this plan and check it out. And you know what? He could try it and in whatever month, April, May, say, you know what? We want to go back. We want to go back to the plan F
Uh-huh.
or something. And you don't have to wait the whole year either. But
Oh, okay.
yeah, no, it's just
Okay.
it has to be within a year.
Mhm.
But
No, we would take your suggestions because you do so much of this. You're always comparing everything. So, we respect your opinion on all this. So, yeah, I think to me it sounds like it's well worth it. I'm going to look up those prescriptions, but like I said, the Eliquis was the highest. My prescriptions are all tier one, so
yeah,
that's I don't have much to worry about with that.
yeah,
But
yeah.
all right, let me check out these few things that I wrote down, and I know December 7th. I'll let you know before that.
Yeah, take your time. I think this is tough because Thanksgiving and stuff like that. People are starting to get ready
Yeah.
and whatnot. So
I
yeah, take your time.
Yeah, I always ask you a good time to call you back because I know you're so busy at this time. Next week is good, do you think?
Any week is any time.
Let
I
you
mean,
know.
obviously,
Okay.
if I can answer, I'll answer. I'm going to be working every day besides Thanksgiving. Um,
Mm-hmm.
Sunday I have, or possibly Monday, I have to help someone move some stuff But besides that, I'm always sitting in front of my desk. I just plan on,
Okay.
yeah.
All right. Then I won't call you Monday. I won't call you Thanksgiving, and I won't call you Monday. So, all right.
Okay.
Okay, then I'll talk to you, Brian. Yeah, thanks a lot for all that information.
Yeah, my pleasure. I'll talk to you soon.
All right, have a happy Thanksgiving.
You do the same. Take care.
Thank you. Take care.
You're
Bye
welcome.
now.
Bye now.